Welcome to Adapting Class. If you miss a SATA question, it does not mean you don't know the content. It's the approach. In these few minutes, I have 10 questions covering multiple systems. I'm going to show you how you use your content and a little bit of common sense with strategy to put it together to answer these next generation questions with SATA questions. Let's get to it. How do you approach it? I always say, read the question from the back. This is what? Heart failure question. When you read it, it will tell you it's a heart failure question. Read it from the back and then go for the keywords. This will help you solidify your content that you know. And then we apply some common sense to approach each question. Look at the way I'm going to approach this question. First, I read it from the back. It's a select or apply. What? SATA question. What is the question is asking me? Which statement indicate correct understanding? That means the patient has to understand what is going on. They have to reproduce it to you. A nurse is providing discharge teaching. You know, SATA questions always come in the discharge teaching form, teaching question. That's the type of question you have identified is a teaching question to a client with what? Heart failure. So now you know the keywords in the question. I call them the buzzword. I have a patient who has heart failure, is going home. I've provided a teaching, and they need to reproduce that teaching to me for me to know that they understand what I taught them. It's a selected apply. This new generation, next generation, you don't need to pick everything. Pick those that you are 100% confident. I'm 100% confident. I'm not guessing. I'm using my content to underline it. That's all. That's the approach. Now, let's look at each question. You focusing on the things I've underlined. Bring your content to what? Heart failure. I know you know what is heart failure. It did not say left or right heart failure. It does not matter. It's heart failure. So that is what I'm bringing to the table. Heart failure. Every question, think about it like a heart failure. Don't think about it as an isolated and regard each question as one question. Don't compare anything. So, first question, I will weigh myself every morning. Is that compatible with heart failure? I should call my provider if I gain 3 pounds in a week. Is that true? I will take ibuprofen for joint pain. I will stay on frozen food to avoid high sodium. You see, I should drink fluid freely. That's what they're saying. I will report increased shortness of breath. What else do you need? You know the answer choice. I don't even have to pick the answer, but you can stop the video and think about it based on what I've told you. Heart failure. What is the biggest thing about heart failure? Fluid, number one. And what causes the fluid? Sodium, number two. Therefore, this combination is a problem. And how would I know I'm retaining my fluid? Weighing yourself. You see, you use your content, spend few seconds, you said, heart failure, I should avoid too much fluid, I should avoid sodium, I should weigh myself to know if I'm gaining weight. Then you bring your bag of content and analyze the answer choice. That's all. I will weigh myself every morning so that I can know that I've gained weight. Boom, you got it. That's a common sense answer choice you pick. I should call my provider if I gain 3 pounds in a week. That's also a common sense question, but you said, I know my content. There's some particular answers you got to bring your content. I know my content. My content say, if I gain 3 pounds in 1 to 2 days, it's a problem. But 3 pounds in 1 week, no, that's not true. That's not what my content says. Just because it said I gain weight doesn't mean it's right. You know your answer choice. You know your content. Don't guess anymore. Bring it to you, and you know this is wrong because it's 1 week. I will take ibuprofen for joint pain. You know, ibuprofen, based on your content, is what? Retain fluid. And the whole premises of heart failure is to avoid fluid. Therefore, I can say you ibuprofen. I will stay on frozen food to avoid high sodium. Of course, high sodium is a trap. But what is the problem? Frozen food contains a bunch of high sodium. Therefore, you want to avoid high sodium by you eating the wrong thing. Common sense, I cancel you. I should drink fluid freely. We said fluid problem. You can't just drink gallons of fluid. You're going to gain weight. Therefore, that's a problem. Our report increase what? Shortness of breath. I don't even have to give you a reason why, because just by common sense, if you have shortness of breath, that's an indication of a heart failure. This is how you do select or apply. If you have problem with it, I want you to repeat what I've done multiple times, and you can see this is a straightforward question. But if you even know one, you can pick it. But the current NGN, next generation questions, SATA questions, you cannot overselect. As you can see, there is only 2 answers that are right. If you pick 3, at least one of them is wrong. Assuming one of them is wrong, right? What is going to happen? They will subtract your 2 answers that are right from 1, and you get 1 point. If you pick 4 and 2 are right, and 2 will be wrong, you get 0. So you always, if you pick 1 and that one is right, you get 1 point. So you always want to pick those that you are 100% confident. They will subtract points from you if you overselect. So that's what we are. Same strategy. This is a delegation question. You have to bring your content with delegation. And next is delegating tasks to a UAP. Which tasks are appropriate to delegate? Select or apply. Same thing. Same strategy. Don't rush and look at the answer choice. Let's use our common sense and our content. These 2 together. They are the 2 C's. Common sense and content together. And then we pick an answer choice. Select or apply. Tell yourself, I'm not over-selecting which tasks of who, delegate to who, to the UAP. And so what? No, you can't say and so what, because you got to bring your content. Okay, what do I need to know about a UAP? All they know about is ADL and anything that does not require thinking. No assessment, evaluation, teaching. Oh, that's all I need. Therefore, when I see in a question my content that I've spent time to analyze it, I'm looking at each question under the vision, eyes of those 2 C's, right? Obtain vitals on a stable client. There is no thinking. There's no what? Assessment, evaluation. Something should trigger that, oh, this may be right. Ambulated client 24 hours post-surgery. I'm just walking the patient. That's the ADL. Boom, I got it. Perform a sterile dressing change. There's a word sterile there. Changing something. I got to assess the wound. I got to do so many sterile techniques. I don't see that. ADL, anything that does not require thinking, I'm running away from it. Assist with feeding a client with what? Dysphagia. Patient has dysphagia. That's a big problem. I may have to assess if he's coughing or if they're having a problem. I got to question that. You have to be 100% sure that, is there anything about it? Why did they tell me patient has dysphagia? Maybe they may have some aspiration risks associated with that. Collect a urine specimen. Oh, I go to the urine bag, I empty it. What do I need to do? There's no steroid there, nothing. I may be doing something right. Teach, incentives perimeter use. There's a word teaching. I know I shouldn't be teaching anybody. I walk away. How you answer question, that's the content, a little bit of common sense. And you can see that our answer is A, B, and E. That's all. Don't over-select. Don't overpick. If you are not sure, just leave it and walk away. That's all. As much as you can. Just walk away as much as you can. Otherwise, you lose point. A nurse is caring for a client with chronic COPD. Which finding indicate acute deterioration? Select or apply. Same thing. We have a case where we have a COPD patient. What is wrong with them? Go for the buzzword. Select or apply. SATA question. Acute deterioration, right? I have a COPD. That means I should see this patient going down, having conditions that may tell you they're having exacerbation. Change the word into exacerbation. That's all. I know you know a COPD patient in exacerbation, you know what to see. One said use of accessory muscle. What do you think? Barrel-shaped chest. Do you expect that in a COPD patient who is having exacerbation, new onset restlessness? What do you think? Saturation, 88%. Unrume, right? Unrume, pay attention. Cyanosis of the lips and an increased sputum thickness. Pause the video, try to answer it yourself based on the content, the strategy I've told you. COPD patient, buzzword, and acute decompensation. That's all. You know your content. Bring your content to the question and then try to figure out the answers. What do you think? If you're using your accessory muscle, it's a common sense answer choice. Nobody breathe and use the accessory muscles. They call accessory muscles because we don't use them most of the time. When you breathe, your diaphragm and intercostal muscles. When you have to use accessory muscles and additional muscles you're recruiting, that tell you, I'm in trouble. You got to pick this one. Barrel-shaped chest. This is a trap. It does not tell me the patient is in distress. It's just the shape of the chest wall in patient with emphysema. You've seen it before, but when you are applying a little bit of common sense, you say, the question says the patient is decompensating. Why does the shape of the chest be a sign of I'm having problem? Don't pick it. A new onset restlessness. Whenever you have restlessness, you are hypoxic. I will pick you. Saturation 88. This is a trap. COPD patient, the saturation usually 80, 89, usually COPD patient, usually saturation is 88 to 89, 90, 91. Roommate is not getting oxygen. It's different when they're getting oxygen, but this patient is not getting oxygen, so that's fine. The lips is blue, cyanosis, of course, no argument about it. And if you're making a bunch of secretion, probably you're having exacerbation, like bronchitis. They may be having infection. So that will be taken. And you can see how we can analyze each question by using good old common sense and our content that we have know about to answer this question. This is how you do select or apply. Don't let anybody tell you otherwise. You know the content. You don't have to overselect. If the answer choice is confusing, walk away. Walk away. Don't guess. There's no point guessing. Which finding are unexpected and require follow-up. That is the buzzword. Underlying, that means you should not expect it in that patient. Select or apply. And nurse is assessing 32 weeks old gestation. This is a maternity, pregnancy, red flags. Like I told you, I went through every system to show you, you know, select or apply. You just have to step back, analyze the question, bring your content, and the good old common sense. He said, look at each other question and see if they apply. Unexpected finding. That means if this is expected, I walk away. Just because I know it doesn't mean I have to pick it. Sudden facial edema in a 32-week-old. What do you think? In a 32 weeks old pregnant, in a 32 weeks pregnant patient, what do you think? Mild ankle swelling at the end of the day. Swelling at the end of the day. This is the blood pressure, 152/96. She's in 32 weeks. Headache, that is not going away, persistent. Fetal movement felt daily. Baby is moving every day. Visual disturbances. I do not want to trap you, I give you things that NCLEX will ask you. So why do you trap yourself by picking things you want to pick? Knee-jerk reaction over selection. I said 32 weeks unexpected, require follow-up. That means they are bad things. Which of this is a bad thing? Stop it. This is pregnancy, red flags. What do you think? You can have edema anywhere, but in your face when you're pregnant, we got to worry about it. And the word sudden is a problem. Your ankle is swelled, but what? At the end of the day, and they put mild there. Don't fall for it. Age swell, when a pregnant lady is upright for a long time, you're going to have edema because blood go to the leg. Look at the blood pressure. 32 weeks pregnant with this, I got to worry about preeclampsia. And if you have headache, it's not going away, you can have headache, but the word said persistent, I should worry about you too. Baby is moving every day. Oh, man, I'm not picking you. And if you have vision changes, I got to worry about you. So these are all signs of preeclampsia. I put it in the form so that you can see. I never said preeclampsia, but I told you 32 weeks with all these things should concern you. That's all. That's what the question is asking. You don't expect them to put preeclampsia there. Therefore, this one, that one, and that one are bad problems. And this is caring for a client receiving what? Regular insulin. This is what? Insulin, diabetic patient, endocrine. I'm taking you through each system, which finding indicate hypoglycemia. Selected apply. Once again, stop the video, analyze it the way I'm doing it. Don't look at the answer choice until you figure out your strategy. Selected apply. Tell yourself, it's a SATA. I'm not picking everything unless all of them are right. Hypoglycemia, and I'm giving insulin. That means my sugar is low. When your sugar is low, do you think you'll be happy? No. Your body will be fighting for things to give you more energy, right? You want to bring more energy into the system. You're not going to be calm. You're going to be sweaty. All the things you would think about, say, oh, I'm going to be in the upper state. Everything is going up. Even if I don't know the signs and symptoms, I'm going to be mad that I don't have sugar. Therefore, I'm using that test-taking strategy and that common sense. And I will say, looking at every question, I have to be upper, right? You sweaty, you hyper, you are thermal. Hey, same thing. Fruity. Think about it. Don't fall for it. We say hypoglycemia. Who get fruity breath? It's somebody whose sugar is high and it went to decay. Therefore, wrong answer. Confusion is because there's no energy there. There's no energy. My blood glucose is 62. 62. For the NCLEX, less than 70, my blood glucose is 62. It is acceptable to say that when your glucose is less than 70, you are hypoglycemic. Therefore, this patient, we have a problem. Deep, rapid respiration. This is consistent with DKA. Our sugar is low. So you got to pay attention to the words in the question and don't fall for anything they will give you. After you've analyzed the question and bring your content and know what you're looking for, that's what you're going to pick. Therefore, we will pick A, B, D, E based on our content of signs and symptoms of hypoglycemia. Same strategy, select or apply. And then she's preparing to administer digoxin. This is digoxin toxicity, which finding required the nurse to hold the medication and notify the provider. Medication administration safety on digoxin, the same thing. Safety, hold the medication, let the doctor know. This is what? Rescue thinking. You don't want to give the medication to cause a problem. Therefore, what do you think? What do you think? Apical pulse of 62. Think about it. Glucose, serum potassium of 3.1. Think about it. Scotomas. Think about it. blood pressure 138/84, and nausea and vomiting. Go back to your content and tell yourself, in Digoxin, this is how I master the content. I draw a caricature and I said, you're going to have neural problem, confusion. You're going to have what? Eye problem, changing vision, scotomas, everything, yellow vision. Your mouth is there, and a GI symptoms is a problem. Your heart is there, cardiac, what? Block, and then your kidney, we have a problem. Those are the signs and symptoms. When I think about Digoxin, I don't even memorize it. And then you come to yourself, you say, epical pulse of 62. Say, they did not tell me anything. That means it's an adult. An adult, 60, child, 70, and then unit. Less than this, you got to hold it. 62, we got to keep it. Serum potassium, hypoglycemia, bad problem. Digoxin toxicity. Scotomas, if you don't know, is a blind spot. Vision changes. I don't know what it is, but if you have an idea and you say high problem, pick it. If you don't know, just leave it. Don't overguess. If you don't know what's scotomas on Digoxin and you have no idea, just leave it in the test. But I'm telling you today, it's a blind spot. Next time you know it, it's a Digoxin signs and symptoms. Blood pressure is normal. Leave it alone. Nausea, vomiting, you tell yourself, oh, GI symptoms, therefore I got to pick it. You see how I approach selected apply? If you do that, trust me, every selected apply, you will pick a bunch of answers without no panicking. And this is caring for a client with dysphagia after a stroke. There's a reason why there's a word there, dysphagia after stroke. That means you want to do what? Aspiration. That's what the question is asking you. After you analyze the question, it becomes easier. If you don't, it becomes like a abstract thing you're thinking about. You wanted to make it relatable. Dysphagia after stroke, I'm worrying about aspiration. Therefore, the whole question is asking me about aspiration. And I put it here to help you reduce aspiration. Therefore, you know anything that will cause aspiration is bad. Elevate the head of the bed to 90 degrees during what? Meal. What do you think? Provide them thick liquid. Why thick? Food placed on unaffected side of the mouth. Maybe one side is paralyzed. Offer thin liquid between bites. What do you think? Why did they say thick and then now thin? Something is not right. Keep suction equipment at bedside. They said aspiration. Is that consistent? Have the client lay flat after meal. We said aspiration. Here they said 90 degrees. Now we're placing them flat after they eat. Why? This is what I call common sense thinking. You can't say there's 1, 2, 3, 4, 5, 6 questions. There's 6 answers there. Don't worry, you got it. Apply your strategy. And I tackle each one of them using this strategy. Elevate the head of the bed to 90 degrees during meal. Wow. Okay, it means upright. They just upright. Therefore, this is good. A, I said what? Provide thick liquid. Well, thick liquid does not move that fast. So slowly, it can go through the airway. It does not move that fast. So slowly, they can swallow and manage it carefully. If it's thin liquid, easy to aspirate with. That's why we want to make it thick. Oh, I'm placing the food on the unaffected so that if one side is drooling, I put it on the other side, it's good. Now, if I'm giving you a thick liquid, why would I have to give you thin liquid? Whether you're eating or not, after meal, after bite, this is bad problem. They're going to aspirate. Keep suction equipment at bedside. I'm worrying about aspiration. Why would I put you in the fly position after you eat? You're going to aspirate. And you can see, I know you know this, you hasten this because I know your score, but I would like to know, put it down and said, I hate this one. Select or apply and master it. And this is the way I want you to think about these kind of questions. They are not difficult. They just concept, put it together, teaching, put it together, diagnosis, put it together, education, put it together. Same thing. This is the same thing. Intervention for 4, things you do, management of care, fundamentals, care a nurse is caring for an older adult with what? Dehydration, which intervention reduces 4 risks. 4 risks. It has nothing to do with dehydration. 4, I want to do something, they don't fall. Place the bed in the lowest position. Keep the core light within reach. Apply wrist restraint. Encourage the client to ambulate independently. Provide non-skid footwear. Hourly rounds. When I say common sense, I mean it. And put your content and wrap it around it. And it said, oh, if I'm falling, the bed is the lowest position. Falling from the lowest position is, you're not going to cause too much harm. They will roll over. This is good. If they can see the light, put the light on before they get up, it's good. So keep the core light within your reach. If they need you, they may try to get up, but if there's a core light bell within the reach, they will press on it. They'll get to you. That's good. Restraining a patient does not prevent them from falling. They will try to get themselves off the restraint and rather fall down. You see the strategy? Walking alone with dehydration, who is at risk of fall, is a bad thing. Non-skid, something that does not slide, good thing. And if you check of them multiple times, good. I'm making it so that you can see what the NCLEX do. You don't want to trap. If you do questions on the Q banks and don't panic. When you see select apply, I bet you it's the easiest. You get more points than single questions, because single question is either you know it or no, one answer choice. But this one you may have more than one. Sometimes only one answer though, so you be careful. Prioritization patient. You have 6 patients. A nurse is assessing 6 clients on the medical unit. Which finding required the nurse to intervene first? Select or apply. A new onset confusion in a client with pneumonia. Chronic tremor in a client with what? Parkinson's disease. A sudden unequal pupil after what? Head injury. Report of worst headache of my life, right? Worst headache. Mild headache after a lumbar puncture. And a GCS that has decreased from what? 15 to 13. This is neuro. If you need more neuro, check out Dr. class. I'm going to help you master neuro questions. I have a bunch of videos you can watch. But look, this is a select or apply. You don't have to over-select. If one of them making you overthink, just leave it. But we're going to break it down. And you can see, I have pneumonia. Pneumonia has nothing to do with your head. Therefore, if I see confusion as an unexpected finding, pneumonia patients should not be confused. They should have fever, they should be coughing, their saturation should go down. Why would the pneumonia patient confused? It's because they have what? Sepsis, and because they have sepsis, and because they have sepsis. That's a bad problem. This is your question, answer choice. Parkinson's disease patient. I should want them to tremor. They have chronic tremor. Don't worry about it. Unequal people, hey, when your people are not equal, something is wrong with it. We got to do something about it. The headache can happen, but if it's the worst ever, subarachnoid hemorrhage, that's a buzzword for that. If you do lumbar puncture, supposed to get headache. If you don't get headache, something is wrong. If you have mild headache, good luck with that. GCS should go up, should not decrease. So if you went from 15 to 3, you're having a problem. These are samples to help you understand, select or apply, so that when you see it, you don't panic. And the last question is perioperative care. You see this all. You've seen patients have surgery. There may be normal finding. Don't over-select. Perioperative care, perioperative nursing can be tricky, which finding require immediate follow-up. That means you got to do something now. It may be normal, even though it's not normal to you. A nurse is caring for a client 12 hours after abdominal surgery. Abdominal surgery. SATA question, select or apply. NCLEX question. Oxygen saturation, 91%. On roommate, he just had surgery. Roommate, think about it. Incisional pain, he rated what? 6 out of 10. He just had surgery, 12 hours. Urine output, 15 ml per hour. What do you think? Heart rate of 118 beat per minute. Bowel sounds, absent. Blood pressure, 88 over 52, 54. What do you think? This is your last question. Stop it. Put the answer choice in the comment section. Let me know which one you select. Like I said, it's not therapy question designed to help you understand how to select or apply or SATA questions are framed. We're just using the concept of perioperative care to tell you when they ask you a question, they want to know if you can prioritize this patient, rescue thinking. That's go. 901, I don't, is fine. Why would you pick it? Don't pick it. It's fine. Roommate. It's not. Saturation 901 after surgery, expected finding. Incisional pain, 6 out of 10. I don't expect your pain to be 0. Ignore it. But your urine output is less than 30. It's a problem. It shouldn't be tachycardic. Bowel sound will take some time to wake up, negative. And your blood pressure is low. This is Adapting Class, English practice questions and answers, English review questions on select or apply using common sense, SATA questions. I know you mastered them. If you need more, watch the next video that I will link it in the description or put it at the end of the end screens. And I want you to click on it. It will help you master more select or apply and more prioritization question. And if you need more, join Adapting Class, subscribe so that you can get more content and be a member of our channel with the small token. Take care of yourself and good luck in your exams. Bye.